स्कोप अँड लिमिटेशन जनरल डिस्कशन झाले बरोबर. सो जनरल डिस्कशन मध्ये कोण कोणते पॉइंट्स घेतले. पहिल्यांदा स्कोपचे सांगा कोण कोणते. पहिला स्कोप आहे होमिओपॅथीचा. होमिओपॅथी हॅज अ होलिस्टिक अप्रोच. ओके. होलिस्टिक अप्रोच म्हणजे काय. मॅन ॲज अ होल मीन्स काय डिफरन्स आहे आपला अप्रोच मध्ये आणि अदर मेथोडॉलॉजीच्या अप्रोच मध्ये. एक मिनट. हाँ आपका आवाज अच्छा है.
अदर मेथड में अदर जो पैथी है उसमें डिजीज को मल्टीलेंटिक के मतलब मल्टीलेंटिक ट्रीटमेंट देते हैं. अदर डिजीज को ट्रीटमेंट देते हैं. ठीक है. और होम्योपैथी में होलिस्टिक अप्रोच बोला मतलब ऐसे पूरे इंडिविजुअल को देखेंगे सिर्फ डिजीज को डिजीज के हिसाब से नहीं.
वेरी गुड. तो कैसे देखना चाहिए. होलिस्टिक अप्रोच वाइज देखना चाहिए हर किसी में या फिर डिजीज एस्पेक्ट वाइज देखना चाहिए. डिजीज मतलब पैथोलॉजी. कौन सा अप्रोच लॉजिकल है ज्यादा. होलिस्टिक. उसकी वजह से होलिस्टिक अप्रोच इज अ स्कोप ऑफ होमियोपैथी. नाउ टेल मी द सेकंड स्कोप. इंडिविजुअलाइजेशन. ओके. What is the meaning of individualization? Different one. Raise your finger. घाबरायचं नाही. इंटरव्ह्यू नंतर करतोय आपण. मजा मस्ती झाली. तो कोण सांगेल इंडिव्हिज्युअलायझेशन म्हणजे काय. What is the meaning of individualization? Yes.
तो इंडिविजुअलाइजेशन मतलब जैसे कि होलिस्टिक अप्रोच हम ले रहे हैं पूरा बॉडी ट्रीटमेंट में. बट हमको इंडिविजुअलाइजेशन में ऐसा करना कि जो हर पर्सन है वो यूनिक है. अपने आप में यूनिक है. सबसे अलग है. हो सकता है सब 2-3-4% मतलब एक ही फीवर हो. डेंगू हुआ लेकिन डेंगू इसका ये मतलब नहीं कि सबको एक ही मेडिसिन लगेगा. ऐसा वो पर्टिकुलर हर इंडिविजुअल का उसका कॉन्स्टिट्यूशन अलग होगा. टेम्परामेंट अलग होगा. उसका माइंड अलग होगा. तो वो उसको हम इंडिविजुअलाइजेशन बोलेंगे. मतलब जैसे एक पर्टिकुलर इंडिविजुअल को पूरा यूनिक देखेंगे. एक हमारे लिए पूरा न्यू केस होगा. हमारे लिए वो जैसे जैसे दूसरे पैचिंग में भीड़ बकरी की तरह जैसे कि एक डिवाइड कर दिया कि हाँ ये डेंगू तो डेंगू को ये मेडिसिन मिलेगा ये मेडिसिन मिलेगा फिक्स है. तो वैसा अपने होम्योपैथी में नहीं है.
हाँ लेकिन you want to say कि every human being is different from one another. That is individualization. तो उसका रेलेवेंस क्या है डिजीज में. इसके आगे का क्वेश्चन है. Question ahead of this individualization, I agree कि every person is different from one another.
हर पर्सन का ससेप्टिबिलिटी अलग रहेगा. तो जैसे ससेप्टिबिलिटी अलग होगा तो ससेप्टिबिलिटी के हिसाब से वो उसका लेवल मालूम पड़ेगा कि कितना उसका वाइटल फॉर्टिलेंस हुआ है कितना नहीं हुआ है उसके हिसाब.
ठीक है. थैंक यू.
सर एग्जांपल सर की तुम्ही दिलं होतं क्लास मध्ये.
What I am asking, I know what is individualization right now. ठीक है. One person is different from another. What is the relevance of individualization in treating the pathology?
इंडिव्हिज्युअल डिसीजला वेगळ्या पद्धतीने एक्सप्रेस करेल कारण की तो वेगळा आहे. तर हे त्याचे रिलेव्हन्स आहे. बाकीच्या ॲलोपॅथी सिस्टीममध्ये काय असतं की जर त्याला डेंग्यू झालेला आहे हे सिम्पटम्स आहे दिस मेडिसिन बी गिवन टू डेंग्यू. म्हणजे होमिओपॅथी वी विल जज अकॉर्डिंग टू द सिम्पटम्स की त्याला काय सिम्पटम्स आले तो पर्सन कसा आहे.
How that matters change in the treatment. What is the difference between those two patients practically? Characteristic symptoms. Okay. ठीक है. अजून कोणी. What I am asking is what is the relevance of individualization in treating the pathology? Let's take the same pathology. What is the relevance in treating the same pathology between two patients? Example, today you are treating the patients of pneumonitis. If you have 5 patients, or let's take 3 patients, patient number A, B, C. So you will individualize all 3. Do we हाँ.
Sir, according to homeopathy, when we see the holistic approach, we come from mental sphere to physical sphere. So when we are investigating each individual, we first of all we see the element from each individual will belong to different elements. After that, we will search out and find out the uncommon symptoms, then characteristic symptoms. We will.
No, yes, I got it. But what I want is a proper answer. Thank you. What I want is a proper answer. Why we individualize and what is the relevance of individualization? First thing, let's take the patients of pneumonitis. 3 patients. What common symptomatology will see in those 3 patients? Cough is the common for all 3. Fever is the common for all 3. Go ahead.
But more
Difficulty in breathing.
Inflammation
Yes.
in the lungs will be common for all 3. What will be uncommon?
modalities will be different.
Modalities will be different. Yes. According to his inner body, according to the miasmatic predispositions, the modalities will be different. One will get aggravated in this weather, cold weather, one will be not. One will require air, one will say stop the air. Okay. So this is in a modality level. Go ahead. What will be the difference between all 3 patients?
Ailments from.
Ailments form will be different. Okay. Mind symptom will be different. See, you don't have to give so important to the mind. Huh? You have to keep it clear what things are important. Sometimes there are patients where you will not see any of the mind symptom and you have to prescribe only on the physical. This is also a case. You don't have to put mind forcefully inside. Okay? So what will be uncommon? 4th year चे विद्यार्थी तुम्ही. अनकॉमन गोष्ट या तिघांमध्ये जी अनकॉमन आहे तुम्ही सांगितलं माइंड अनकॉमन आहे. ठीक आहे. मॉडॅलिटीज अनकॉमन आहे. कॉन्स्टिट्यूशन ओके.
Desire, aversion.
फिजिकल जनरल्स अनकॉमन आहे.
Yes.
त्याचा उगम कुठून झाला? फ्रॉम वेअर इट केम. इट्स फ्रॉम देअर.
Susceptibility.
That is their miasm. That is their chronic nature of their body. That is where we have to hit, we have to see, and that is something which is uncommon. Let's take an example. If somebody says, my cough is aggravated by lying, so you will go in repertory and see the remedies which is given under that rubric. If somebody says, my cough is aggravated only at night, somebody will say, my cough is aggravated only in this closed room. I need to go out in the open and I will be relieved. This is needed or not needed?
Needed.
Needed. This is uncommon or common?
Uncommon.
This is uncommon. So, according to this symptomatology, what you get? What you get is this.
Individual.
Let's go further. If somebody says, I am thirsty for large quantity, large interval, एक तांब्या पाणी पितो मी दर 2 तासाने किंवा दर 4 तासाने, since the pneumonia, this is common or uncommon?
Uncommon.
So this is
Individualization.
somebody will say, I am absolutely thirstless, I don't need water. Since 24 hours, I have hardly had 30, 40, 30 ml or 100 ml. This is uncommon, yes, individualization. So, which will take you to the group of remedy as a guiding symptom. Because homeopathy has a mantra medica where you will see so many remedies are there parallel to each other in the pathology. If you go and search this pathology pneumonitis, inflammation lungs, you will see 500 medicines listed. Which one to give is according to this, according to the individualization. We'll go ahead. If somebody says, since pneumonia, I am very irritable, provocation, my mind goes, in irritability. So you will ask, was this there before the pneumonitis? He will say no. Since pneumonia, since fever, I am so much irritated. That's one voice, one question from my wife. Do you need water or do you need tea? Do you need food? Do you need something? Irritates me a lot. So this is what?
Individualization.
This will take you to the remedy which you need. Amongst those 500 remedies which are listed here in pneumonia. So we don't have a single remedy or a particular format of treatment in pneumonia. We have many remedies. Amongst that, we select one according to
Individual.
this is the relevance. So important. Individualization. That this A person is aggravation lying down, the B person is thirsty for large quantity, the C person is getting irritable by provocation. So the three patients with the same pathology will need same remedy or different remedy? Different remedy. Most probably. Okay? So this is the relevance of individualization. Holism, you know that man is not only made up of body, the particular physical body, not the organ. It has a mind, mental sphere. It has a mental organ too. It has an emotional organ too, like an organ like heart. It has an emotion as an organ. So you have to see that organ also. You are getting what I am saying? I am saying emotions are an organ. Like you have a heart. Mind, will, emotion, intellect, memory, these are organs. Like you have kidney, like you have liver. So you don't have to see only physical body, you have to see the entire body, including the organs of physical body, organs of emotional body, organs of mental body. You can't see like a modern science, what they call, only physical body. You have to see overall. That's why the relevance of holistic approach. Second is individualization. Next. Dynamic. So dynamic diseases. What does it mean by dynamic diseases? Homeopathy has a scope in dynamism. Dynamic disease. What does it mean by that? Dynamic disease म्हणजे काय?
डिजीज मटेरियलिस्टिक म्हणजे
Disease?
मटेरियलिस्टिक बाकी फोर कंटिन्यूस
Diseases are not only materialistic. Diseases are not only materialistic. Explain this. What do you want to say?
सर
या सेंटेन्सला काय आकार आहे ना? हां.
सर जैसे कि अगर सपोज अगर डिजीज मटेरियलिस्टिक होता
No. Explain me this theoretically. What does mean by diseases are not only materialistic? हाँ.
सर अगर डिजीज अगर मटेरियलिस्टिक होता तो लाइक जैसे कि बैक्टीरिया वायरस के कारण जो भी अगर किसी को कोल्ड फीवर हो रहा है जैसे दूसरे पैथी में एलोपैथी में बोला गया कि किसी को अगर कोल्ड फीवर हो कुछ भी अगर वायरल गया तो वायरस फीवर हुआ तो उनका कहना कि मटेरियलिस्टिक वायरस के कारण हुआ बट अगर सेम ऐसे ही अगर ये एग्जैक्ट रीजन होता तो उस वायरस के एक्सपोजर में जितने भी ऑर्गेनिज्म आते हैं जितने भी इंडिविजुअल आते हैं उन सबको उनको डिजीज होना चाहिए था अगर ये मटेरियलिस्टिक होता तो
अगर materialistic होता
तो
if the diseases are only materialistic, then everybody should get infected by the organism.
यस सर बट लेकिन जैसे कि अब ये बात तो सच है कि वायरस का आने के कारण उसको बीमारी हुआ बट सिर्फ वो मटेरियलिस्टिक उसका नहीं बोला जा सकता क्योंकि कुछ ना अगर ऐसा होता तो सब में वायरस कर
So everybody should have get infected by those that certain
Yes,
virus or maybe bacteria or maybe fungi if he gets a contact. But everybody is not infected. Why?
तो
Because the diseases are
dynamic.
dynamic. What does mean by dynamic? So viruses and the microorganisms, or what they call as bacteria, viruses and fungi, they are not only the sole cause of the disease. Okay? So they are secondary cause of disease. What is the primary cause?
Derangement of vital
Derangement of vital force.
Yes, derangement of vital force. So derangement of vital force comes from which reason? Yes, yes. And the susceptibility comes from? Yes, the predisposition, the miasm. Okay, the chronic body. So you should have the susceptibility to get affected by the organism first. That is the primary cause, and that comes from miasm. So until and unless you have this susceptibility, you will be not infected by that microorganism. Once this susceptibility comes, and by chance if the organism comes, then the combination makes you susceptible for that disease, and there will be excitation or formation of that disease. Example. What is the example? If I have a tuberculosis and I am coming in front of you, 50 people, very close. So, do you all 50 will get that tuberculosis? No. Those who are susceptible, only they will get it. So, the secondary cause is the bacteria, but the primary cause is susceptibility. Unless you have this susceptibility, you can't get it. That is what is
Dynamic diseases.
next go. Fourth. Cardinal principles. So you, as a homeopath, we have certain laws and theory and doctrines. We work according to that law. We have a certain format and we go according to that format because that format is scientific and we follow that format. We are not people who follow an irrelevant format, like give anything to any patient, which is not even needed. So we see the entire thing and we focus on what is needed. We prescribe according to the laws. So we have a strong base inside the laws from which we take the help and we prescribe. Next is fifth, drug proving. Yes. So this is sixth number or fifth number? Fifth. So drug proving. So in homeopathy, drug proving is done on what?
Healthy humans.
Humans. That too, healthy humans. Why not on the animals?
We can't get subjective symptoms.
Why?
एनिमल्स और ह्यूमंस का अलग होता है एनाटॉमी के लिए.
Yes. The animals and humans both have different anatomy and different physiology altogether. There is no match. That's why. Next is sorry? Cure. Yes. Cure. So, yes, we eradicate the disease totally in rightly terms, which we call as cure, permanent cure. Aphorism number 2. Not just palliation, not just temporary treatment, not just palliation. no